And sticking with the recovery space, this one was specifically posed to Dr. Yang. What can I expect in terms of pain and discomfort during the recovery period? How will my recovery be monitored? And what tests or imaging, we talked about this part, during follow-up appointments, and what are the potential complications that can arise during or after surgery?
Yes. So in terms of pain and discomfort, I think that with good pain medicine, the pain and discomfort usually can be around 3 out of 10. So 10 being the worst pain of your life, one being no pain. I think that we can usually get patients at around three immediately after the operation. And then probably after about a couple weeks later, I would say a lot of patients no longer have any pain, but some might have still some discomfort, and then eventually it goes away. I always like to tell patients that their pain actually, without medication, their pain will go up the first few weeks because they become more active. And so it's totally fine to take more pain medicine during that period of time. And we really try to stay on top of pain because we want patients to feel very comfortable. And I have noticed that people who worry a lot tend to need more pain medicine, and that's also normal. Let's see, in terms of the second question, the
Oh, the
third question was on
recovery,
topic.
the complications kind of acutely and kind of more long term.
Okay, yeah. So I think the most common complication is prolonged air leak. So when you have and when anytime you do lung surgery, your lung can get irritated and it can leak air, or and that usually just stops on its own. It usually seals up after a day, but sometimes for some patients it takes a while, and so in that case you'd have to have a chest tube for longer than 5 to 7 days. That doesn't happen that often. At our institution, it happens about 5% of the time. And I think other types of complications are very similar to the complications of any kind of surgery. So things like having clots to the lungs, having a heart attack, and things like that. But those are thankfully in this day and age very rare. And then the last thing I think you had asked was about the tests and imaging that are performed during follow-up. For stage 1 lung cancer, we usually just do a CT scan of the chest every 6 months. And for higher risk patients, for higher stages, we'll often add a brain MRI to that.